Hi there, it's Justin Lubino with Senior Advisors. Today's Friday, October 13th, 2023. Wanted to create this short video to explain some of the changes that were announced yesterday from both CMS, Center for Medicare and Medicaid Services, as well as Social Security. Before we jump in, just want to say if you enjoy our content, if you could please like the video, comment on the video, subscribe to us. That allows more folks to see the video and get this valuable content. So what are some of the changes coming for 2024? Well, Social Security announced a cost of living adjustment increase of 3.2%. So for the average person who's getting Social Security, that's over $50 a month that they'll get additional in their monthly check starting for next year. Some of that, however, will be offset by what CMS announced, which is the Part B premium is increasing roughly $10 a month from $164.90 up to $174.70 per month. And that's the base amount. If you're in a higher income bracket, we're going to discuss what the impacts are to you for the Part B premiums. The other big change was the deductible for Part B. It's going from $226 up to $240 for next year. So if you have a Medicare supplement, the more popular ones are Plan G or Plan N, where you're responsible to meet that deductible, it's going up $14 for next year. There were some significant changes to Part D for next year, which we've covered in prior videos, so we're not going to go over those again here. The biggest change really, however, is if you do have very expensive medications and you get to that catastrophic phase with Part D, you will have zero cost sharing once you get there. So there'll be sort of a cap on your drug cost for next year. Okay, so I mentioned if you're in a higher income bracket, there are some changes as well to these. They're called IRMAAs, income-related monthly adjustment amounts. So this chart here shows us what those changes are for next year. On the right side of this table, we can see the first change is the income bracket increase, which generally happens each year for the base income. So they bumped this up a little bit to $103,000 for single filer and $206,000 for joint filers. So as long as you're below those income thresholds, you're just going to pay the base Part B premium, which is again is $174.70 per month. However, if you're in one of these higher income brackets, you can see the additional amount that you'll have to pay the government for the Part B and the IRMAAs for Part B for next year. Now, there is also an IRMAA for Part D, as in drugs. So in addition to paying that higher amount for Part B, as in boy, if you're in one of these higher income brackets, you also have to pay an IRMAA for Part D, as in drugs. You can see the base, if you're in the base income, you're just paying the plan premium. That's the amount you're paying the insurance company for that drug plan, which could vary from next year. There's some zero premium drug plans all the way up over $150 a month. Just depends on your medications. We have other videos that explain, how to pick the most cost-effective drug plan. But if you're in a higher income bracket, in addition to the plan premium, you also pay this IRMAA for the drug coverage to the government. So you could see $12.90 a month, $33, all the way up to $81 a month if you happen to be in that top income bracket. Now, we've also summed these numbers up together on this slide. So you can see if you happen to be in one of those higher income brackets, this is the total you'll pay to the government for the Part B, the IRMAAs for Part B and Part D. So again, if you're in the base income, it's just $174.70 a month. If you're in one of these higher brackets, this is the total, $257 or $382, $508, all the way up, up to $675 a month if you have fortunate enough to be in that top income bracket. Now, what income is the government using to determine these IRMAAs? Well, it's the last tax return that they've processed. So, for example, for the end of this year, which is 2023, the last tax return the government has is your 2022 return, right? So they're using your 2022, it's called modified adjusted gross income, which for most people is going to be the same as your AGI or your adjusted gross income. But they're using that figure to determine your 2024 premiums and IRMAAs. So in a lot of cases, you've had a life event like a work stoppage or work reduction, and then you're no longer going to be making that income from 2 years prior. So there is an appeals process for these IRMAAs, which we have a separate video on that explains. So I'm not going to get into a lot of detail here, But this is the form that you would use if you're going to have like the work stoppage or work reduction. You put in the date of the event and you put in your projected income for the following year, and you submit this to Social Security when you get that IRMAA letter. And they basically just take your word for it, and they'll drop you back to the correct bracket based upon your projected income after the life event. So like I said, we've got another video that explains that appeal process in more detail. I'll link to that here so you can see that if you'd like. Some other changes that were announced for next year are around the Part A cost sharing. Part A is the hospital benefit with Medicare. And if you have a Medicare supplement, like an F, a G, or an N, you don't have to really worry about these because these are all going to be covered by your supplement. But if you don't have a supplement, for example, and you just have original Medicare, which would be a lot of exposure, but if that's the case, this is what your Part A deductible from 2023 is going from $1,600 to $1,632 in 2024. If you're in the hospital for more than 60 days in a particular stay, you have a daily copay with just Medicare and no supplement. So that's going up from $400 to $408. And if you're in the hospital for more than 90 days, that daily copay goes up to $800 per day. And that's going to increase $16 for next year. Again, and then for skilled nursing, the first 20 days are covered fully by Medicare, as long as you've had a 3-day hospitalization for like a stroke or a knee replacement. This is for like rehabilitation. The first 20 days will be fully covered. But after that, day 21 through 100, there's a daily copay, which is going up to $204 per day. Again, if you have a supplement, plan F, G, or N, for example, which are the more popular ones, that supplement will cover all these copays and deductibles for you, so you wouldn't have to worry about that. And then, as we mentioned earlier, the Part B deductible is going up $14 for next year. So those are the big highlights we wanted to cover in this video. We do have another video out there that explains all the Part D changes that are coming, so I'll link to that here so you can see those changes that are coming. If you have any questions, feel free to reach out to us. You can go to our website to book a phone call. You can call one of our offices. We've got 2 in New Jersey, 1 in Arizona, but we can help folks all over the country. So if you have questions, feel free to reach out. Subscribe to us on YouTube. Follow us on LinkedIn. You'll get all of our latest updates there. So hope everyone has a great rest of your day. Thank you.